Welcome to Vegas Circle with Paki and Chris. And today, joining the circle, we're excited to sit down with a psychiatrist and partner of Alliance Mental Health Specialists. We got Dr. Faisal Suba. So welcome to the circle.
Welcome.
Thank you. Thank you both for having me here today.
Yeah. Yeah, it's good to have you, man. We were talking offline and said we thought this was going to be a psychology or session trying to size us
Vegas
up.
Circle live.
We've been nervous the whole time.
I have my prescription pad in the car, so we're ready to go.
Get it going. Yeah. So jumping right in, what made you become a psychiatrist? Yeah.
You know, it's actually so funny. So my parents, they're Asian descent, right? So Pakistani, and I didn't really have a choice. It was either become a doctor or a doctor. I really
a doctor, yeah.
Yeah, and I kind of always wanted to do like, and for me, it was like I was a people person, business, things like that. Those were always like on the forefront of my mind, like business, law, something like that.
Mm-hmm.
So this was kind of like a good compromise because I found psychiatry to be one of the fields of medicine where you really get to know your patient. You know, you have conversations with them. You can develop these relationships, and you see them progress, and you see them improve, and these relationships they last a long time. You
Change
know?
people's lives.
You change people's lives.
Yeah,
yeah.
for sure.
It was fascinating. Like when I first did my rotation in psychiatry, I was like, well, this is it. Like this is what I want to do.
Yeah. It's very interesting because most fields seem like they're transactional, to your point. It's like you come in, do your job, and you pass them on, and you're really not thinking about it. Yeah, psychiatry is like about 10, 15 years, long-term patients. That's kind of a very interesting dynamic that I never even thought about.
Yeah, and you know, it's not like with a lot of other fields, like in medicine, like there's a lot of protocol stuff, right? Person comes in with hypertension or diabetes or gout. I mean, there's like oh, you do this, this, right? With psychiatry, I mean, a person, I mean, you can diagnose fine. They might have a diagnosis of like major depression, but that's not usually all, right?
Yeah.
There's so much more, right? And you tailor the treatment to the person. And that's what we try to do, you know, at our practice. That's kind of like our goal. And we try to like, you know, look at everyone as an individual and then not look at everyone like okay, A, B, C, you know, like not like a protocol type thing like that.
No, I love the especially in Las Vegas, right? There's been a lot of concern. I wanted to, you know, get into a little bit of that, but it's amazing what everybody's been dealing with, especially during the pandemic and all these new things and social media and all these things that are dealing with the mind. It's wild. So when did you and Dr. Park open up your practice? Yeah.
So there were three partners total.
Okay,
in the beginning, and so we have Dr. Chang also. He's part of our practice as well. But we opened in 2016, and we started so we all did our residency training together here in Nevada, and so the whole time, like from the beginning, like I remember, like I would talk to my wife. I'm like, you know, this is something that we can really make a difference here. We were thinking of leaving the state after I finished my program. Yeah. Myself, Dr. Park was thinking of going back to California. I was thinking about going back to New York. But then I remember distinctly having like that conversation with my wife. She's like, you know, and she's a PA. She's in our practice too. And she's like, you know, this is the place where there's a big need, right? And mental health over here was like, we were like 50th in the country, you know, like that's 49 or 50, whatever it was in the country.
So
back when I was
schools, unfortunately,
back when for mental health, I'm saying,
yeah,
not
but
just,
I'm saying
not
the
just
schools too. Yeah,
schools too,
tough
right.
situation. Yeah,
but for mental health, it was like that. And then what I noticed when I was going through my rotations and things like that, I was like, you know, there's a shortage of psychiatrists, everywhere, but here there was a shortage. But a lot of the psychiatrists, what they were choosing to do was they were choosing to practice a lot in the inpatient realm, right? Because financially, it could be more lucrative, right? Because you know, in the inpatient setting, you have less overhead, you have less costs involved. So Dr. Park and I were like, you know, we have to fulfill the need. So if the treatment, I mean, yes, if someone's very severe, they wind up inpatient, but they need somewhere to go after that. They need somewhere to go once they get discharged, right? Where are they going to go? What's going to happen after? People get dropped. And then there's recidivism. The cycle continues. So we came up with this idea of like, let's open up a practice. And at that time we weren't thinking the a grand scale or anything like that. We're like, okay, let's just open up a practice together. I was thinking my wife was very supportive of the idea. And so we opened up, like there was like 3 or 4 of us. And then slowly we started adding and adding. And before we knew it, I mean, like today, I think we have probably 34, 35 providers.
Oh, wow.
We do inpatient work. We do skilled nursing facility work. We do other like hospital consults. And but the real core, the heart of our practice, I think, is our outpatient.
That's awesome. Yeah, just because of the fact of the rotation, and you don't want them to come back. You want to be able to keep them right. That's excellent. Yeah,
absolutely. And that's what led to us actually. We recently went through this merger with WellCare here.
Okay.
So it's WellCare is a local agency that does a lot of mental health work, a lot of ancillary services that include housing, pharmacy, labs. They do medical and so we were like, the one thing that they needed really badly were psych providers, and they had all the wraparound stuff that we were looking for and we needed. So it was like such a marriage, like such a perfect marriage. And I have high hopes like for what we can accomplish now that we're one agency.
No, I'm glad you did that. Chris, I don't even say.
Yeah, I was just curious, for people like me who don't necessarily understand the difference and what qualifies somebody to be treated by a psychiatrist versus a psychologist or a therapist, like what is kind of that differentiation between those 3 fields? And, is it like, do you specialize in a specific type of mental health services, or is it pretty broad? Like what really separates those changes?
It's a really good question. So, psychiatrists, we're trained in psychotherapy, we're trained in medication management, we're trained in all of these things. It's just that I think because of our specialization with like the psychopharmacology and things like that, a lot of us tend to predominantly do medication management with some supportive psychotherapy on the side. I think though therapy and and the medications hand in hand, that's the key recipe for success. One without the other, I mean, yeah, it could work, but the 2 of them together in combination is what you really need. So we work really closely with a lot of therapists in town. We have therapy in our practice now as well with WellCare, and so we're excited about being able to give the patients like that full gamut.
That makes sense.
And because you guys specialize in treatments from multiple different treatments, from depression to ADHD, bipolar disorder. Why do you think it's such a rise of that now compared to back in the day?
People will answer this question differently. I mean, depending on their perspective. One, it could be that maybe it was always there and it wasn't picked up upon. Maybe the stigma was so high for seeking out mental health that people just didn't go to get diagnosed or get treated, and they would suffer, with the illness themselves, or they would, resort to other things like substance use or something like that to try to mask those symptoms. Others would say resilience. There's some people that are of the opinion that there was just the pressures of today don't equate to the pressures of the old back in the day. I mean, with social media and expectations and things nowadays, I mean, people may not be able to handle that as well.
Yeah,
there's definitely also the genetic predisposition for some of these illnesses. So there's a lot of different factors at play.
There's so many layers, man. I think more than anything, like what I've seen is like people are so embarrassed a lot of the times to talk about it, right? So then that's probably why they might do the abuse of so many different ways of drinking or whatever it is that they're doing to kind of fill that vice. It's tough. So we do need more people like yourself in Vegas. So I'm happy you guys are here. One question I have for you too is, do you do therapy yourself? Like, do you treat for yourself? Because I know a lot of times they say it's such a stressful job that, a lot of psychiatrists are seeking therapy.
So, I don't do like formal therapy, although it might not be a bad idea. We should. I think everybody can benefit from it. But we do talk a lot. Like we do like some informal sessions where, you know, with like collegial type stuff when we go through tough cases or things that are going on. So we're lucky because we're in the environment. We have the people like right there, you know, like if I go through something, I'll go to, you know, Dr. Park is there for me, or I'm there for him, and other people in our practice and things like that. But no, I think therapy is good for all of us.
Yeah, I would agree. It's funny because every time, you know, you'll see some people, you know, you really benefit from therapy. And just the thought of bringing it up, the stigma of that is like, oh no, there's something wrong with me. Like, no, like,
everybody think you're crazy.
Yeah,
like,
but it's not that. Like, it's beneficial, I think, for everybody to have an outlet to be able to not be judged or be confronted, or somebody that's actually looking out for your best mental health interests. And that's to me, it just seems like it's such a. And to your point before, it used to be a stigma, but as we're evolving through that and understanding the more dynamics of the mental health, it's becoming more and more important. Because I would assume, I don't know the statistics, but I would bet depression, anxiety, all of these things are diagnosed at historic paces as according to what they've been before.
You know, the one thing I'll hear a lot about, you know, from patients and things, like when I try to push therapy, or if I try to push, you know, for them to see someone. And I was like, oh, but I have my friends. I have, you know, I have very supportive, you know, mom or dad or this and that. You know, it's good. That's awesome. You know, that's important, right? But the thing is, a therapist is someone who's objective. They don't have any biases. You're able to, you know, speak freely. The conversation that will occur between you and a therapist is going to be completely different, or it should be completely different, or very different, not completely, but very different from that you have with a friend or a loved one, you know. So it's
a very interesting. There's so many layers to it, you know, and suicide is just not an easy conversation at all, and you're seeing so much of it, you know.
We have so many, especially in our kids right now. It's a major problem.
Yeah, and I was reading, it's like the 10th leading cause of death in the United States, and then the average is like 13 years old. I didn't realize it was that crazy. Young. I don't know if it's that 2022, but I know we have a year to be able to get through. I hope it doesn't continue to keep increasing. But you spoke a little bit about social media.
Yeah.
What's your perspective on all the social media? Because you got so many things going on, and you got, you know, the dopamine that people get from getting excited, from getting the likes and all the different things that are there. And obviously the pandemic has been crazy, right? Do you like the idea of social media, or do you not like that?
Man, your questions today are like...
Yeah, is it all? This is for me. I'm having a therapy session for my kids right now. So yeah. No.
So I'm going to answer it. But again, like, there's two ways of looking at it, right? There's good and there's bad from everything. There should be it should be in moderation. I think social media has a place. I do think, though, that a lot of times the way it's utilized is probably not so healthy, right? Especially for our young people. The way that they're interacting, their social interaction and things is, I mean, if your whole day is spent on Instagram or Facebook or wherever that is that they're using, obviously that's not the best. It can be addicting, and you know, there's bullying and things like that can occur through those sites as well. And you know, imagine like I was seeing this 18-year-old, and you know, one of his major things was this whole social media thing that kind of set him off, put him in this depression, state of mind. Like, you know, one post can totally go, it goes everywhere, right? And it's kind of there. It's there for forever.
Yeah, it's
right?
like a stain almost.
It's a stain.
Yeah.
When we grew up, I mean, we're all about the same age range, right? We did a lot of stupid stuff, but I mean, it's gone. You know, it's like
1,000%. There's no. We were literally talking about it last night when we were here. There's no way I would be able to deal with that. No way at all.
So, but I mean, these kids, they don't have it like that.
Yeah.
Right. So, it plays a big role in their mental state. So
I'm sorry. It's kind of interesting because, you know, almost like to that point when we were younger, we didn't have the same platform. Like if we messed up, we would mess up in front of 10 to 15 people at most at a party. Now you're messing up, you're in front of thousands, sometimes hundreds of thousands of people. And it's almost like, you know, from the inside perspective that everything is multiplied, whether it's the exposure of other people that are dealing with suicide issues. And now it's a face for everybody to see. Whereas before you may not have known how prevalent it was, but now it makes it much more common when you're seeing it everywhere. Yeah. So it makes it almost, not to say acceptable, but more like realistic than it was maybe when we were younger.
Yeah. And how do you come back from that?
Yeah,
you know, like,
exactly.
you know, now it's like, so those are the pressures. Those are the pressures that our youth in particular are facing. Well, not just youth. I mean, all of us have those.
Yeah. No, because it's like it's tough. Like my kids aren't on social media, you know, yet. I mean, we block our phones during the week just because it's so addictive, you know, to everything. But it's unreal what people are dealing with, and especially with suicide in general. Like it's so shocking to be able to see it and experience it and everything, and then you see like people like Anthony Bourdain and Robin Williams and all these people that you would never, you don't know they're having an issue. Yeah, and I was curious, just like, how can you, I guess, prevent that in any way? Like, so would you give like our listeners some tips? You know what I mean?
That's where destroying the stigma of mental health. That's where that is so important, and that's what we're doing here tonight. You guys are doing that. Yeah, you guys are a big key role. You play a role in this
for sure
by allowing people like myself to come on the show to talk about mental health, to make it it's okay, right? It's okay not to be okay, and to go and get help.
Yeah. No, I 100% agree with you. I mean, it was great, you know, to be able to have you on and be able to kind of be that backboard for a lot of listeners, because again, the stigma is unreal. But I'm seeing more and more people on their platforms talking about it, you know, because we need that seriously in Vegas.
Yeah, it's, you know, the hardest part is getting started. I think the hardest part is actually when you first make that appointment, you go in, and I try to my best, you know, when I get patients to come, to let them know, like, look, you know, I'm here for you. Right? Yeah. Whatever you say is between us. It's all confidential. What stays in this room, you know, and I'm working for you. I'm working to make your life better. Whatever it is that you say to me, I'm going to utilize to try to develop an understanding of what it must have been like to be you. Right? That's like when I teach students and things like that, I always tell them, I'm like, every portion of your evaluation, every little thing that you ask during that psychiatric evaluation, I want you, as the answer, I want you to think, what must that have been like, right? To put yourself in that environment in your mind without getting like too enmeshed in it, because that's dangerous too. But if you can do that, then, you know, it really allows you to like step inside of your patient's life and really try to help them.
It's always been fascinating. I read a psychology book, I don't know, a long time ago.
You read?
Yeah, I did. One time ago.
Now we do audio. Audio now.
Not all audio. Me too. But when I read through the book, it was very interesting to me, because I felt like the conversations I started to have people in my own head were very different, because I started, even to an extent, like, oh, I think they're dealing with this, or I think they're dealing with that. You know, to be somebody as knowledgeable as you are on the subject and has gone through this so many times, how hard is it from you to like separate your personal self from, you know, the ability to just diagnose on a fly like that?
I think every psychiatrist gets asked this question.
Yeah, it's like, a very interesting concept.
Oh, are you judging me? Are you analyzing me? Hey.
That's what you think all the time. That's what we were thinking the whole time. So he's going to start interviewing us.
And for me, it's more like interesting, like, how do you personally navigate those waters where you can, you know, separate yourself from that behavior, so you can allow yourself to have a normal kind of dynamic with somebody instead of evolving through that. Because that was where I found myself running to that issue, and I was like, I need to pull away from this. Like, this is a little bit hard.
Unfortunately, like, a lot of times it's difficult, because people approach you and they come to you because they know you're in the mental health field, and that's okay. I mean, I'm happy to help. You know, like, that's what I'm here for. But it does become a little bit difficult. But you know, you explain, like, you know, there's a time and a place, and, you know, we need to be in a secure setting, and we can talk about it like that. But as far as analyzing people and stuff on the fly, no, you can turn that off. Like,
okay, that's what I was.
You do turn it off.
You've been doing it long enough to know, because it'll make your mind start going. Yeah. What would you give our listeners, like, advice of people that might be on the verge of suicide right now? You know, maybe they're listening because it's definitely a problem. You know what I mean? What would you say to that person?
I would say that that's obviously, you know, not the answer. And someone like myself, I've seen people who have been in the worst of circumstance, the worst of situations, and they've come through, and they're doing like phenomenal.
That's
Right.
awesome,
So that's not the answer, obviously. And they should obviously seek help immediately. There's so many avenues, so many ways to get help. There's hotlines, there's therapy offices, there's psychiatry hospitals, there's emergency rooms. You know, there's help everywhere.
Yeah.
And they shouldn't be afraid. Like even calling 911, they're like, oh, you know, if I call 911, you know, like what if something happens, or they go to they take me to jail. That's not. Our officers are trained here, and our metro officers, they're actually, you'd be surprised at how well trained and how well they can recognize mental health and mental illness, and how they can guide and take people to the right places.
Oh, I didn't know that. That's interesting.
Yeah, that's very good to know.
Yeah.
Do you find like, from us, because we're not obviously trained, right? So do you see like where you can see if somebody's faking it, or they're trying to get like a rise out of, you know what I'm saying? Like you always see that all the time.
There's inconsistencies that we can catch sometimes, but generally, you know, unless I'm doing a forensic evaluation, or I'm doing something like for a court, or for like you know, workers' comp or something like that, where you're, you know, they're not really your patient. You're doing an evaluation for something, right?
Okay.
Unless it's for that, you know, if you're coming to me, you're coming to me for help, right?
Yes.
It would be a waste of your time and energy and all that, like, and mine too, you know. So if you're telling me something, I'm gonna
take it seriously.
Yeah,
for sure. Yeah.
And try to help you the best that I can.
Yeah.
Obviously, I mean, if you're looking for, there are people that come to you for certain medications.
Yeah,
and things
of course.
like that.
That's what I was getting at. That's what I was getting at.
Yeah.
Because they take advantage of, you know what I mean, of you, or whatever the scenario is to get drugs.
So yeah, we have our ways.
He sized it up. Yeah. He didn't want to tell me his way. I was trying to get it. Yeah. He's like, he's not gonna get that out there. He knows what it is. He's gonna tell me like, yeah, we're trying to get something right now. So that's funny. That's funny. Yeah. Just backing up a little bit, because I know you were in school in Vegas. Did you have to take like general business classes to kind of open up your practice, or is that something you were focused on?
They don't teach you in medical school. That is one of the. And that's one of the reasons why a lot of doctors, they wind up working for poor people.
Sure.
Because you don't learn the general principles of business.
Mm-hmm. Yeah.
We learn on the fly.
Yeah.
Thankfully there were a lot of people there to help us and guide us and things like that. And then even now, like, we got the practice to a certain size, right? But it becomes, business is tough. It's overwhelming. And now we're lucky, like the people that we're involved with now, like the WellCare people, they are business guys. You know, these guys know their stuff, right?
Yeah.
And to have them as part of our team, it'll definitely help us to grow, and help even more people. You know, throughout Nevada, not just Las Vegas. We have practice in Reno and here, so we have both. And with COVID, actually. We were able to start the telepsychiatry, right?
Oh, okay. Yeah.
And that,
you beat me to it. That was a question.
Oh, you were? Oh,
yeah.
I'm sorry.
No, I'm good. I'm glad you brought that up. I was curious with virtual, everything going on. So
the virtual thing. So when COVID happened, we had to pivot, because, I mean, how do we get patients to come to us?
Of course.
Already, when patients have mental health issues, depression, severe depression, or severe anxiety, agoraphobia, or even like other conditions, they tend to cancel the appointment, or they don't show up, or whatever it is. So, you know, no-show rates can be quite high in psychiatric practices. With telehealth, there's minimal no-show risk, because you're sending basically a text message link to their phone or to the iPad or to their computer. They're at home. They're in the comfort of their home. The amount of people that we've been able to reach and help, especially during COVID, is just, I don't know. Yeah, it's unreal. Yeah.
I'm seeing so many people, because obviously us being a business show, right? It's like they've done very, very well during the pandemic, because they've been able to pivot, you know what I mean, and being able to do that. And they've done extremely well because of that, especially going virtual.
I think in business, being able to pivot is probably the most important quality that you could possess. I mean, you can't freak out. I mean, there's always going to be ups and downs. There's always going to be issues and problems. You cannot be scared. You have to just you got to think outside the box, and you have to be able to make that move and maneuver to be successful.
Kind of not having the formal education in business and learning as you go. What has been like your biggest challenges that you've dealt with and had to work through over the years?
I mean, there's been with this type of business. I mean, you have hospitals, you have competition, you have insurance companies. It's a delicate balance on how you navigate through these waters. You have to, and your ultimate responsibility is to your patient, right?
Sure.
Because you have to make sure that they're taken care of well. The biggest, I mean, all of those have been challenging.
I can't even imagine.
But knowing, I think knowing your strengths and your weaknesses, and being able to really, for me anyway, like I know what my strengths are. I know what Dr. Park's strengths are. I know what my other psychiatrists. I know I have their pulse, right? So
you know them well too,
utilizing all of our strengths and then and understanding our limitations and weaknesses. I think that's the key. That was the key to success for our practice.
Makes sense.
I was gonna have you, because I've never heard you say it before, but ask him a question in Arabic.
Oh, my Arabic is not very good.
I wanted to see you ask him that. Though. That's great.
Funny, so, I hardly speak Arabic.
Oh, you think I'm great?
I wanted to see you ask.
I know Kayful Halik and Ismi Faisal. That's
I know a bunch of curse words I learned.
I know some of those, but we can't do that.
So I'm messing with you on the spot. Yeah. No, it's interesting that, you talk about that, and as far as failures and stuff like that, but. With us being a business show, what business advice would you give somebody that maybe wants to get in business for themselves, or maybe that they want to be a competitor of yours, but maybe they want to try to help Las Vegas and open up some kind of practice to help, better our future?
Don't be scared.
Yeah.
Don't be scared. There's nothing that you can't do.
Yeah.
Right. I mean, if someone else, you just have to be persistent, and you have to believe in yourself, and you just got to do it. You got to find a need and a niche that is unmet, and you just have to go for it.
Yeah, no, that's a great response. It's funny because you mentioned not the money. You said you wanted to help.
Yeah,
and then the money comes
if your intention in life is good, things will work out. If your intention is good and you are persistent, it's just I don't know what it is, but it's just. It just seems to work, and I don't know. In my life, at least, that's what it's
simple. Simple makes it easier too. I like what you said. Don't be scared to just go with it. Just kind of transition a little bit. We ask all of our guests about food, of course. So, what's your favorite restaurant in Las Vegas?
Oh man, now you can't.
I need to know.
That's a hard one.
Yeah,
no, it's not a hard one.
It's too much competition.
Yeah, I go to quite a few places, and if I name a name, and that'd be bad.
You gotta give us one. Say something off the strip, hole in the wall.
Oh man, my go-to place right now, I think, is probably Vintner's Grill.
Vintner Grill's good.
I like
Charleston.
Vintner's.
Yeah,
it's
very
close
good
to my
food.
house, and I frequent that a lot.
Yeah,
nice.
No, that's a great restaurant. You don't even know it's a restaurant; it's in an office space. It's hidden. So that's a great recommendation. What else are you focused on for this year, as far as business or personal? Whatever.
So right now, our key, since we went through this merger, is really to see how we can take our patients, and not just medication management, but take them from all these different settings and arenas, right? Whether it be the hospital setting or a skilled nursing facility, or whether it's a outpatient setting, and see if we can meet all of their mental health needs. That has been a challenge. With WellCare, one of their biggest strengths is they have a lot of housing, right? So we want to try to focus. Unfortunately, a lot of the mental health falls in the homeless, the indigent population.
Yes,
and these people get lost, right? I mean, you see them on the strip. You see them, they're suffering, right?
Yeah.
They're suffering through mental illness, and then substance abuse and all these other things. So this housing component I found to be a very integral part that WellCare had, right? And I saw that and I was like, man, that's huge. You know, if we can get them into stable housing, we can get them into our clinics, we can get them into our network, you know, of providers, whether it be therapy, medications, whatever, you know. What a difference could we make in Las Vegas or in Nevada, in Nevada, not just
because you
the
do
whole,
Reno also. Yeah,
we're in all of Nevada. I mean, and this, you know, you could replicate this. You can take this model. You can go other places, and how much could we help? You know, everyone's always talking about, oh, well, we need to do more for mental health. We need to do more. Well, we're gonna do it.
Yeah,
I think awesome. that we're prime. We're in a position to actually do it.
That's awesome.
We're looking forward to seeing that.
No, it's great, man. It's actually an absolute pleasure to have you on, just to kind of share. You know what I mean? This is something we've been wanting to do for a long time, and I'm glad we've been able to have you come on and just kind of touch a little bit on the surface. But where can people find, you know, the clinic, and can you kind of shout it out, or any of the social handles or anything?
So we have we're on Facebook, we're on the social media, Google, so whatever.
Okay.
So the agency is Alliance Mental Health Specialists. WellCare is another website that you can go to. Our clinic's phone number is 702-485-2100.
Awesome.
We're on Decatur between Tropicana and Flamingo. So
excellent. Yeah. Well, absolute pleasure, Dr. Suba. It's great to be able to to be able to sit down here and pick your brain a little bit, and you can be able to check us out at thevegascircle.com. So please subscribe with us too. So thank you, sir.
Thank you.
Appreciate you.
No, I appreciate
that was great.